Good morning, good afternoon, or good evening, whenever you're choosing to tune in. Just know we always appreciate it. We are full disclosure here, breaking down what's happening in the PBM world and bring clarity to an otherwise opaque space. I'm Chris Estep, joined with me, as always, my co host, Andy Rodriguez. Together, we are directors of business development at DisclosedRx. And if you're following along in our journey, episode 1, we brought on our founder of our company. Episode 2, we brought on our direct boss. So it just seems apparently the only way we know how to book guests is risking unemployment status. But today we decided to class things up a little bit and brought on Dave Chase from Health Rosetta.
So to further protect ourselves, and just a quick note, everything you hear on this podcast reflects our personal opinions and those of our guests, not DisclosedRx or any other affiliated organization. We're here to share perspectives and spark conversation and not give official guidance or advice.
Absolutely. And Dave, why don't you take a moment here, introduce yourself to the guest, who you are, what you do, just tell them really all about you.
Yeah, my name's Dave Chase, and I am the co-founder of Health Rosetta. I'm also the board president of Nautilus Health Institute, which is a 501c3 that we helped get off the ground, but it's independent. And sometimes I just will use my books and TED Talk as a way of describing where I'm focused. My TED Talk was a decade ago. It was Healthcare Stole the American Dream. Here's how we take it back. And then Health Rosetta really launched with my first book. The title of that was The CEO's Guide to Restoring the American Dream. And the subtitle was How to Deliver World-Class Healthcare at Half the Cost. And that's what we've been doing, and we'll probably get into a little bit, but our theory of change was if we could prove that thousands of times and it stuck for several years, then we would open source our methods, and that's what Nautilus Health Institute's about.
Absolutely. And we'll definitely get into knowledge. I think it's a really cool thing that's going on there. But kind of starting here, I mean, one thing I've always found very interesting about Health Rosetta is that it doesn't really approach healthcare from a traditional carrier or vendor perspective. It feels much more employer focused, almost like teaching purchasers how to stop accidentally buying chaos. And candidly, healthcare may be the only industry where someone can spend millions of dollars a year and still have absolutely no idea what they're actually purchasing. So for people unfamiliar with Health Rosetta, Dave, what was the original problem you were trying to solve?
Yeah, well, I mean, employers are the biggest group of purchasers of healthcare in America. You know, it's about 180 million Americans, more than Medicare and Medicaid combined. Yet, you know, they really sold a system really where you couldn't see what you're buying, like you said. And, you know, we found that 95% of employers treat those contracts that are what a health plan is, like I treat terms of service on some consumer website. Check, I agree. You know, I'd spent years on kind of the tech solution side, having founded Microsoft's healthcare business many moons ago. Yet I watched this dynamic where you had, you know, super sharp CFOs who'd scrutinize every line item. You know, they would have their procurement department, you know, and expense reporting department, you know, reject, you know, a $76 expense report item because it's missing the restaurant receipt, and then they'd pay sight unseen six-figure hospital bill. Seems kind of weird. And so, you know, we really started with the idea of like, we need to put the purchasers into the power they really already have, and they may just not, you know, recognize it. And they just needed a blueprint on how to, you know, as my book said, get health, you know, world-class healthcare at half the cost. And that sounds like, you know, some crazy infomercial, but it's actually something that's happening all over the country right now.
Yeah, and I think, you know, looking from the employer side, I mean, when did you realize employers were fundamentally disadvantaged in how they purchased healthcare?
Yeah, I mean, the role that you know, I wrote about years before starting Health Rosetta as the benefit advisor, benefit consultant, and the title of or headline of the article in Forbes was "This Job Could Save America," and talked about how the best of them, you know, could radically transform what was happening. And unfortunately, a lot of employers were doing the equivalent of, you know, like you're gonna sue somebody, and or they're gonna sue you, and your attorney represents both sides, right? That seems kind of odd. And unfortunately, we found up to 17 undisclosed revenue streams that some of the traditional models had, and the brokers were part of that. And we'd hear terms thrown around like, transparency. Certainly a great concept. We believe in it. But sometimes it really wasn't there when you looked at it. And just the asymmetry of what's being purchased with what the knowledge is just wasn't there. And so, one of the areas that we've engaged in terms of public policy is on transparency. If you're spending hundreds of thousands or millions, even in some cases billions as an employer, you ought to be able to follow the money. And, like any high value service, there's no reason why you can't be transparent on it. And, we had this dynamic where, the buyer brings a checkbook, but the other side brings, a 1,000-page contract and a team of people whose, bonus depends on the buyer not reading page 47, and that was just not right. And so we knew that was a solvable problem, and that's what we're up to.
Yeah, I think it's funny. Absolutely, employers feel the same thing. They feel like they should be able to track where all the money's going, but then at the same time, they feel as if though they're shackled in the sense that they can't do it. Do you think most employers actually just underestimate how much influence they actually have over this healthcare system?
Yeah, most think that they're just price takers. Unlike everything else a company purchases where they set the terms and then go out to bid. It's just kind of the, hey, industry, what do you got? And we'll just take the least bad of that. And they just don't think they have an option. But the truth is, nothing in the system moves without employer dollars. Nearly every business model in healthcare is predicated on employers overpaying. And so when even a handful of purchasers in a region demand, real contracts, real accountability, the market actually moves. We've seen this recently, single hospital town, 900-pound gorilla in their region. And we just said, what, they're not high value, and we're not going to keep people from going there, but we're going to provide a really nice incentive, like you pay exactly zero for the best surgeons in your state and the best facilities. Guess what? Most people will drive an hour or two. And so, kind of mother may I is not going to necessarily work with a bully. When you move the dollars, then they pay attention. And right. The leverage was always there. It just sat unused. And you frankly don't have to move that much to get their attention.
Yeah, I agree 100%. And to that point, as these employers are kind of navigating this, and you guys are kind of seeing this trend happen, what are some of the biggest mistakes that employers can make when evaluating healthcare vendors today?
Well, they buy a sales deck rather than a contract. Those are really different things, and they often tell opposite stories. And two, they'll confuse a low admin fee with low total cost, when the real money is hidden downstream in spreads and rebates and steering. And three, they treat their broker's compensation as none of their business. It's actually the law now to have it be their business, but it always should have been, when it's the symptom of a much bigger driver of what they're sold all over. When you fix all three of those with visibility, then everything changes.
Yeah, visibility is the biggest thing. I mean, if you never go to a grocery store and check out without seeing the price tag, why would you do that in your benefit spend? And it's substantially higher. Do you think healthcare industry historically has benefited from complexity staying in place? Because sometimes it just feels like healthcare contracts were written by a group of attorneys locked in a room in a competition for who can make the least understandable paragraph imaginable.
Yeah. No, they definitely, complexity is the only way you can kind of get away with it. If the contracts were, readable by, mere mortals, the margins wouldn't survive. But fortunately, the optimistic part is, complexity is only powerful when it's not examined. And the moment you put a standard up against it and you know how to do that, and probably talk about it a little bit later, but like AI has actually been, that's a good use of AI. That's when it collapses, and that's the game now. Replacing trust us with something you can actually measure in quantifiable terms.
And I think that naturally connects to the PBM world because pharmacy benefits might be one of the best examples of employers buying something they can't often fully see. One thing that feels a little different right now, Dave, is employers seem more engaged than they were ever than a few years ago. And it's not just in PBMs, it's healthcare purchasers in general seem less willing to blindly accept the trust us strategy. Which may be the most disruptive thing to happen in healthcare in decades. Do you think that employers are becoming a little bit more sophisticated now in their healthcare purchasing?
Yeah, absolutely. And I'd say there's a few dynamics. One is there's, legal changes, and there's a legal target on, companies' backs. Before there was we've heard it forever. It seems like this isn't sustainable, and it's finally reached, real breaking point. And they also have a generational shift. And I think that, the way these plans were built, it was in an era where there was a higher level of trust, and, the trust was more earned. But this was, really today's plans aren't that much different than, something in the 1960s, when the greatest generation and boomers were the main part of the workforce. It was acute conditions were the main issue. Today, it's chronic disease, it's mental health, and 70+% of the workforce are Gen Z and millennials, and they expect transparency, and they don't necessarily trust big organizations. And so I think all those things are leading to a sophistication. And then there's some tools, we're working on some of them, but we're not the only ones. And then there's obviously companies like DiscloseRx that are making things more straightforward. And again, complexity masks profiteering. And I heard somebody say, where there's mystery, there's margin. And so the smartest employers are just treating their health plan like any other major procurement. And healthcare is probably the second biggest item for most companies. Define what good looks like and then hold the vendors to it. Pretty straightforward.
Yeah, I love that actually. Where do you think the industry still confuses transparency with actual accountability, Dave?
Yeah. Transparency is a PDF of your data. Accountability is a contract clause. You can enforce it, and you get, full data. And, the industry loves to give you kind of a very slanted and partial part of the picture and call it transparency. But if the protections aren't written into the contract, transparency doesn't exist. And, data without standards is just noise that you're paying for.
I love that. Data without information is just noise, right? So what does accountability actually look like from an employer perspective?
Yeah, I mean, I'm not an attorney. I never thought I would get excited about contracts. They usually, make me want to like run for the hills. But it's interesting. Like these contracts are the thing, right, that governs everything in healthcare. Like after all, what's a health plan? It doesn't provide any care. It's not a medication, but it governs everything. It defines every term, names every dollar. Gives you or doesn't give you the right to audit. Can give you or not give you access to claims data. And so it looks like knowing exactly where everybody in the chain gets paid, right? And I think of a benefit advisor at their best, they're like an outside accounting firm or legal counsel or a management consultant that's got relationships at the highest level of the organization. They charge a lot of money, but they charge for it transparently, and so that was one of the reasons why, when we launched in 2017, the compensation disclosure standard for direct and indirect compensation was, a given. you join. Now it's the law of the land, right? We were the template for the disclosure provisions in the Consolidated Appropriations Act of 2021. And accountability, is the idea that, really made it enforceable. And, when there were hearings for that, there was like, boo-hoo, this is going to be, too much work, too, whatever. And like, wait a second, over there's thousands of companies, hundreds of brokers that are small organizations. They don't seem to be having a problem. What's the issue? And it beat that down. And so that's what's happening, is just, it's becoming the new market norm.
Yeah,
And it is the law.
I agree. Why do you think healthcare historically struggled to create, let's say, standardized expectations for vendors and partners?
Well, everybody in healthcare except the real payers, employers and the employees, benefit when spending goes up. So were they going to write the standard that was all about value? And it's like many areas, like when you have the wrong incentives, it's kind of a given what's going to happen. And so, it's why it had to come from an independent body, not a vendor, not a carrier. Standards really only mean something. The people writing them don't profit from the loopholes. And that's what this has been about.
Yeah, it's a solid point. Do you think employers are finally realizing how much leverage they actually have collectively? Because for a long time, healthcare purchasing felt like buying a used car where somehow nobody's allowed to open the hood.
Yeah. No, collective action is key, and they're waking up to it. I mean, the used car analogies, I'll run with that. Imagine rather than being that solo buyer, every buyer was able to like virtually be in the parking lot with you comparing their notes. And that's really what's happening now. There's coalitions, there's peer benchmarking, there's shared standards. I mean, what we're doing in Health Rosetta is a piece of it. And the first thing I tell any employer is find out where you stand. It's sort of like a GPS. You need to know where you're at in order to know where you're going. So there's a free tool called a plan grader. It scores the overall plan. And we've got thousands of them. And yeah, we're tough graders, but it's all stuff that's being done. Most status quo plans will get between a 5 and a 17. And it ends up being very educational. Heck, just reading the questions is educational, we've heard. Because they, some cases they didn't know something, or they're like, hey, I was told that we couldn't do that. Well, that's not true. But, I can understand why you're told that. But you can't, at the end of the day, you can't fix what you can't measure. And most employers haven't measured. And, one of the things we brought to the table was quantifying qualitative things. And if you look at the plan grader, it's really just a summation, abstraction of the 40 most important questions that basically summarize what's in those contracts. And, you think about that CFO who may not, have spent their career in healthcare procurement, and you say, hey, your plan has a 23 out of 100 on this. Like, they may not know the ins and outs. Obviously, that's why they hire good consultants and advisors. And you give them that information. They're like, wait, like I could do something about this? Heck yeah. So you have folks like Russell DeBose at Pfeiffer Inc., where they thought they were really on top of it, and compared to most employers, they were. But they scored a 37. They're like, whoa, like I thought we were ahead of the class. Can we do something about this? Heck yeah. They're at 74 over the last 6-7 years, and they haven't seen spending go up while they've been improving their benefits dramatically and putting money back into and resources back into their employees. They're paying for college scholarships. They're doing summer enrichment programs like summer camps right now, all kinds of things. Every year they add something new. And they're definitely not done at 74. They can continue to improve, and they are absolutely taking that approach. In fact, one of the areas I know they're working on right now is the PBM arena, because they scored their contract that had been signed before the Consolidated Appropriation Act of 2026. So it's forward-looking, but they're forward-looking. And I think it was 28. And they're like, okay, how do we get to 98? And so they're working on that, with their PBM.
And I love that. I love the whole tie-in to looking into Nautilus and how to improve your score because one of the when we were preparing for this episode, you had mentioned that Nautilus's work happening around PBM standards. What really interests you wasn't just the score itself, but it was the broader idea of creating measurable expectations employers can actually use, which in healthcare is rare. I mean, most people sound excited right before they try to sell you a dashboard usually. And when you look at the PBM space and PBM reform, most people just think lawsuits, congressional hearing, angry LinkedIn posts with 47 different hashtags, or another consultant inventing a new acronym, God forbid. But Nautilus feels different because instead of just talking about transparency philosophically, they're actually trying to create measurable standards around what good PBM contract should actually contain. So what specifically about Nautilus caught your attention?
Well, I mean, if you look at nautilushealth.org/PBM and you look at the folks involved in helping define excellence, it is like, the who's who, dream team, whatever you want to call it, of the good guys in the PBM arena saying, let's put our heads together. And one of the cool things we found is that the more somebody is on top of their game, they are super busy because everybody wants to work on them and they get hit up all the time. Hey, how do I do this? How do I do that? And we have this conversation of, hey, pour your intellectual property into this. We will synthesize it with everybody else's, make sense of it, make it available. And they're like, wait, that's great. Then you mean I can just point somebody there, rather than having to spend another, half hour on the phone with somebody? Yeah. And they'll do that all day long. And they all want to have the industry change, and they got more than enough business. So we've turned the better contracts into measurable open source that anybody can use for free. I mean, there was in total is about $4 million in intellectual property that were poured into Nautilus as a jumpstart, and that doesn't put a value on, you look at all those people in the advisory groups for the different areas, they're donating their time. That's how you change an industry, not with outrage, but with infrastructure that's actionable.
Agreed.
Yeah, I heard someone say one time at a conference I was at that there's no legislation out there that's going to change this industry fully. It's the people within it that will have to change it. And I think that is so true hearing about this. But for people hearing about Nautilus for the first time, how would you describe what they're trying to accomplish?
Yeah. Well, if you think about it as a standards body for the next healthcare economy, it's like, what is it, Underwriter Laboratories, UL. You see this on a lot of products for like electrical safety. Or what happened with open source for software. What happens is Health Rosetta, battle tests these ideas. Okay, somebody did something over here. Can we actually make it repeatable? It's like, almost like science. Like, you want to make it repeatable, and can you make it repeatable hundreds of times? Yes. Okay, Nautilus, take these proven tools, make them open source, give them away so any employer, advisor, or community can implement them without a fee. And there's going to be some things that there'll be some fees for, so it's sustainable. But the whole point is, when you actually look at these plans, I mean, I'll get philosophical for a minute. If you look at a great health plan and you look at the outcomes, great primary care, appropriate prescribing for the most effective medications, being able to go to centers of excellence for complex procedures, etc. The health outcomes there, if you could put them into a pill, they would be the blockbuster drug of the century, like cancer cure type of impact. I don't know any decent person, if they found the cure to cancer, who wouldn't share that. And that's the kind of human health outcome impact you can have. And yeah, you save a lot of money along the way, but that really is secondary to the human flourishing that it needs to enable.
Absolutely. I mean, our boss always says people innately want to be helpful, right? It doesn't always come down to the dollars and cents. It's just a human nature, right? One thing you did mention, and I think it also relates back to the point you had mentioned about that prior group, PBMs not receiving credit for the protections they have in their in their language there, unless they're contractually defined. Why is that a distinction very important?
Well, yeah, I mean, I think there's very good PBMs that don't do some of the most abusive stuff, but candidly, you can't bank on that staying forever, or they might get acquired by some, more problematic organization. And so, a verbal promise without enforcement value and in black and white, um, you know, saying something like we don't do spread pricing really means nothing if the contract still permits it. And Nautilus gives credit only for what's actually written and actually enforceable. And that's the single discipline. You score the contract, it's not a sales pitch. It really flips the negotiation around. And, Rosetta Fest, later next month, there's going to be PBMs who are going to, they voluntarily, nobody's required to do this, but they voluntarily scored their contracts, worked with the team at Nautilus, and they're going to be folks that when they initially scored their contract, they might have been in the 40s, even though they were good relative to their peers. Again, we're really tough graders, and a bunch of them are now in the 90s because they're like, oh yeah, we can put that into our contract. We don't do that. So it's pretty straightforward, and there's a reason to put it in the writing. At the end of the day, it's pretty simple. The people doing the right thing should win. We should give the market signals as to who's doing it right. And their problem should be how can they deal with fast growth? That's a challenge in its own right, but that's the problem they should have to deal with, not whether they have a chance to really compete.
Yeah, I mean, I will say it till I'm blue in the face. There's no reason that somebody should control 80% of the market if they're also controlling 100% of the bad press. But that's a whole another conversation. Do you think, Dave, that the industry is moving towards more objective accountability measures just overall?
Yeah, healthcare always runs about 15, 20 years behind every other industry. And we're seeing this in a lot of areas. We're just like, trust us, it doesn't work. I mean, I think we're in an era where increasingly people don't trust big organizations, whether it's corporations or government, and why you see a lot of third party. I mentioned UL. I mean, there's things like, B Corps and lead standards and, pick up a cereal box and, see all the different things. And I think when you have that yardstick and you're like, okay, gold, silver, bronze, or 0 to 100, like people intuitively get it. And, when I see something that, is whatever, fair trade chocolate, I'm pretty sure that they're not destroying the environment and using child labor. Like, I don't know all the ins and outs about, rainforest ecosystems and, Sumatra or whatever, but those types of things are really good signals to the purchaser. And so, when employers, and really just doesn't have to be that many, start scoring contracts, then it just sets the new norm, and you have de facto and literal procurement standards. And I think one of the areas you're going to see more and more of that is in the public sector. Like, they're used to procurement standards, and there's a whole ability to piggyback off of another public entity that went through a rigorous RFP. And so we're excited about some of the developments there.
Yeah, I think so too. You're going to start seeing, I mean, word of mouth spreads too. The more people can start to pinpoint this or these solutions, it's just going to spread, or at least it should. And what does that say about the market, Dave? That some organizations improved quickly once expectations just became clearer.
Honestly, we had a tyranny of low expectations, and once you have a clear bar, good actors were just waiting for some objective third party to define good, or better yet, excellent, so they could compete on that. And so when Nautilus published the standards, the better PBMs, they jumped on. I was like, okay, I mean, they had questions, right? And at first, like, wait a second, we're great guys, and we got a 42. What the hell? I mean, I get it. But then they once look at it, and there's some people who are pretty appropriately skeptical, but we're hearing words like, "This is brilliant. This is game changer," and that's the thing where clarity should reward the honest, high value players, and that's what's really starting to happen. We just finished helping out a pretty significant 20,000 person employer through this process, and they're like, oh my gosh, this is great. But then they're appropriately putting in checks. What happens is what we see with this unique perch we've been in, where we get to see what works and what doesn't. The best have this virtuous cycle, right? Procurement methodology, cut it, fight in contracts, prove it in data, rinse and repeat. And if you don't have that cycle, then you're just going to be wallowing in mediocrity and profiteering. But that's an option that most won't take.
Yeah, absolutely. It's kind of like a good story. You know, they always say like every good movie, every good hero has the same story arc. And I think it's the same thing with the good PBMs or employers in this space. Do you think this signals employers are becoming more proactive instead of what they've traditionally always been, which is reactive?
Yeah, I mean, we saw the same thing play out in the retirement benefits. Like, you didn't need that many to, have a class action suit go after them. If you look at the first wave of ERISA fiduciary suits, it's almost all been around the PBM arena. And they frankly look pretty dumb, when you read these complaints. And so, again, they've been told they don't have any option, and unfortunately, they haven't always gotten great advice. But proactive scoring of the contract before you sign it, and having that be accessible at their fingertips, it's really just a question of who's ready to pick it up, and more are doing that. And so we're seeing, like, our Rosetta Fest. I think we're at about 300 employers. Like 2 years ago, we had almost none, other than obviously PBM employs people too, but like non-healthcare employers. And so that's been really exciting to see that kind of interest and community building come together.
And I think that's really important nuance here, because sometimes employers assume, well, if the PBM says they don't do something shady, then we're probably fine. Meanwhile, the contract is sitting there like terms and conditions nobody read before clicking accept, right? I think that's the part that employers underestimate. Most people assume that if a PBM says something verbally, it must automatically exist in the contract somewhere. And then 6 months later, Dave, everyone's sitting in a boardroom saying, wait, that wasn't included? My question is, how big of a problem is vague or undefined contract language in the PBM world?
It's the whole ballgame, really. There's things like as you get down to it, like, how is a generic defined? How is a rebate defined? Is it defined at all? And what counts as a specialty drug this quarter might change, the next quarter, and it's this big, giant shell game, and millions of dollars are moving around, and most employers never read the definitions section. Again, it's not like, the most riveting language, but it's by design meant to defeat you.
Right.
And it doesn't have to be that way, but that's kind of how it's worked up until recently.
Dave, for some of the folks listening in that are HR personnel and CFOs, what are some of the examples of contract terms employers think that they understand but then actually don't?
Yeah, I mean, transparent, pass-through, rebate, would be at the top of the list. Transparent often has no contractual definition, at all. It's sort of motherhood and apple pie. Pass-through can still allow the PBM to keep money through a dozen other doors. And, rebates will quietly exclude fees that got renamed, so they're not technically rebates. So the words can sound reassuring. At the end of the day, the net spending will tell the story. But in the meantime, the definitions or lack thereof will tell the real story and maybe foretell the future.
And based on your most best educated guess, being an expert in the industry, how often do employers assume that protections exist that really aren't there?
I mean, it's north of 90%. And
Wow.
it depends on how charitable I feel on a given day. I'd probably say it's 95%.
Yeah.
The pattern's always there. There was protection that was promised in the meeting. It sounds good. Everybody nodded, but it never actually made it in the contract. And like you said, 6 months later, as a boardroom going, wait, how wasn't that covered? Why are we paying, 100x what we should be paying. And so if it's not in the contract, you don't really have the ability to stop it. And boy, some of the clauses around exiting from a PBM are just unbelievable. Anybody would have ever signed these. Like it's
Worse than a timeshare.
oh, it's Hotel California, you may check in, but you're never going to be able to check out. And
Yeah.
so you got to be really careful.
Nice reference. Love it. Dave, what role, let's switch it up a little bit. What role does Contract X-Ray play in helping employers uncover those blind spots?
Yeah, I mean, it's a pretty amazing tool. It's like we had, with Nautilus, had 3 levels of resources. One is like RFP template. 2, field guide, gives you all this kind of procurement, contracting, data use, model contracts, things to watch for, da 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 da. And then beneath that were things like grading different contract terms. This is quantifying the qualitative. A given contract term can go from 0, it wasn't addressed or it's egregious, and like say great model contract terms of 5, and there's maybe 2 other gradations in between. So it really, all this, several years, basically a decade of work we've been doing, but then there's people who've been doing a lot longer that basically become part of our movement. And AI came at a great time where if you can define excellence like we were talking about earlier, and then you can upload a contract, which you can go to contractxray.com, you get an early look, we're announcing it at Rosetta Fest, upload that PBM contract, and you can get a free quick look, quick score, like 1-2 page report. And what happens is there's excellence defined, then you take the term in the agreement and then map it and then score it and then aggregate it in the 10 most critical fiduciary areas, and then produce a report that is basically a negotiation how-to. Here's your term, here's the model, here's why it matters, here's how to negotiate. And so you want to, be a DIY, do that all on your own. You've got all these tools, and the other people are like, you know what? Just tell me the ones that are above 90, and then I'm going to, I want to talk to them and see some of the other things that, not everything is captured in that score. There's lots of things that a PBM can differentiate on beyond what's in that score. And then the conversation can go there rather than what should be kind of undifferentiated plumbing and sort of rules of the road and assumptions. Like, you think about, there's a lot of things we go through our life with, whether it's, how money moves around in Venmo or how, traffic lights work, that just kind of there. And you're not like having to hold on to your wallet, as you go through the worst pickpocket haven, in the man. And so, yeah, people can go to Contract X-Ray. They don't need to be a contract attorney. You'll just see how it looks. And then, yeah, there's great consultants who can help negotiate it and guide you and all that. There's other important stuff, but it gives you this wonderful baseline.
I love that. Sounds like an incredible tool to help simplify this specific issue. If an employer only looked at a sales presentation versus the actual contract, Dave, how different is the story usually?
Well, the deck's like, a photograph and perfect lighting, some Photoshop, maybe some filters. And, the contract is the way people actually live. And so, just tell employers to do one exercise. Put a sales claim in one column and the contract language in the other. And the gaps in that table are the real negotiation, the real savings. And so, those are the types of things that it's very different, trust but verify. And again, there's some great folks who are making it easier to do that.
I agree. Dave, what would you say what's one contractual issue that almost every single employer should immediately check in their PBM agreement? Because I'm convinced that half the industry strategy for years was, let's just make 47 page on the contract just so confusing that nobody else will ask questions on it.
Yeah, yeah. No, I mean, there's a lot, but I would point to the audit rights and just kind of what it says and the restrictions on that. Where they force you to use a particular firm, and they will say literally like pick claims, and I mean, there's some crazy stuff in audit
Right.
clauses, and that's not an audit. You need to have a third party auditor, and we should not have these overly narrow definitions. And if you can't get that and the answer is no, then really nothing in the contract is truly enforceable because you can never verify it.
Good point.
So that's a good place to start. And then, of course, run the whole thing through Contract X-Ray.
And I absolutely love Contract X-Ray, Nautilus. I sat through the presentation. I was sending it to our team. I was like, "Hey, this is incredible! Like, what are we scoring on this, right?" But let's zoom out a little bit because this conversation is a little bigger than just contracts. I mean, it feels like employers are finally starting to collaborate and align around expectations, which is fantastic. Which brings into play Rosetta Fest. And one thing I really do appreciate about Rosetta Fest is it doesn't feel like just one of those conferences where everyone grabs a tote, drinks burnt coffee, and pretends the breakout sessions just change their life deeply. It feels much more focused on actual employer transformation and practical change. So, what makes Rosetta Fest different from traditional healthcare conferences?
Yeah, I'll start with kind of a general thing that stuck with me when the last day of Rosetta Fest last year. I just kind of walked around the exhibit hall talking with different solutions, like, hey, what was your vibe on this? How did it go? And they're like, you know, one, they're like, there's all these other conferences where you just kind of show up and it's just kind of the same old, same old. It's like there's definitely a community here, and that's the thing is it is the largest gathering of people actually building the next healthcare economy and next supply chain. It's the employers, it's the advisors, it's the community leaders, civic leaders, clinical leaders, and really everybody. It takes a team effort, and so it's shocking to people how open people are and super focused in on news you can use. You leave with a contract clause, an implementation plan, not a lanyard and a hangover, and this year it's also going to be, I'll do a gratuitous plug for my new book, Relocalizing Health, is the name of the title of the book, and the subtitle is Taking Back Healthcare, Rebuilding Communities. And it's really just a tale of success of all over, now that we're about a decade into it, thousands of successes. And then, and it's great, the nuts and bolts and the dollars, and we sweat the details, all that matters. But then when you hear the human impact and what it means in terms of human flourishing, you're like, man, I want some of that juice. And I want it in my community. And, and this year, I'm talking about how there is a collapse underway. And, pick a metaphor. The floods are arriving, and you got to get to higher ground and prepare yourself and prepare your community. And it's not like the cavalry's not coming from DC to fix it, it's on us. And I think that's what you get is, okay, like it's time to man up, woman up, like fix this. Let's go.
Yeah, and you know what? You mentioned humans flourishing, right? And I think that is indicative of some of the conversations that have been going on. So, to that point, what kind of conversations are you seeing happening now that maybe just weren't happening 5 or 10 years ago?
Yeah. I'll be really blunt. I say 10 years ago, there was a lot of like, how do we just make this suck less? You could say a slightly better deal, but like now they're like, and it's kind of this renter mindset versus like, I need to own this. Community owned health plans, direct contract with local providers, and we need the provider side, of course, too. And keeping the dollars in the local economy instead of basically having it extracted out of our community. And more people are realizing, every community has a river of healthcare money flowing through it. And the source of that river of money is all of our pocketbooks. It should work like a water cycle, but instead we have these giant corporate pipelines that are extracting out of our local economies and leaving our communities in drought. And so now, as people are like, okay, you've been told solving healthcare is like trying to solve Middle East peace. That's actually not true. Let's go make it happen. And so that kind of take ownership moment and mindset is so different than what it was 5 or 10 years ago.
Yeah, and take ownership moment, right? I think that's the true evolution of this whole thing, right? And it comes down to the employers. And so, what role do the employers actually play in driving healthcare reform?
You know, employers, it's the only area of permissionless innovation in healthcare, right?
Mm.
Obviously, there's some laws we need to follow. Of course, we do. Um, but you basically can do darn near anything you want to do. And if you work with the right people, you do smart stuff. And if you look at, every reform started in whatever, it started with some individual purchasers who decided to stop accepting the default, and then they joined with other people. I mean, I write about these plucky farmers a century ago when America was getting electrified, and they were told by the investor-owned utilities that were electrifying all the cities, you can't make money there. And they're like, screw that, we're going to do it ourselves. And they built it. And eventually, right, there was help that came, there was legislation, there were loans that came in, and in 20 years time you go from no electrification to virtually all of rural America was electrified in just 20 years, in a time when things moved pretty slow. So that's what's really exciting about what's happening.
And building it themselves, right? That's really almost the heart of coalitions, right? It's kind of built from within to help the people within the community. So, do you think we're entering a period where employer coalitions become one of the biggest forces shaping healthcare?
Yeah, because they can, and the thing is, there are some who are willing to do that work, and they build it themselves. But once you do it in a community, everybody can piggyback off of that if you have the right model, and that's where we see things really accelerate. Like in Ashtabula, Ohio, like it started with one employer, 38 employees, like not exactly Walmart, and then there was some other private sector, but then boom, the little school district there, eighth poorest school district in the state, adopted it for their 300 staff. And then the city manager of their little town, the 550 staff, they're married to a teacher. Like, we want that. And the county's like, wait, we want that. And then the private sector guys are like, wait, I thought we were smarter and more efficient and nimble than public sector. And it's the classic thing of any movement. And as I studied revolutions and social movements and new product category introductions, you only need as little as 3.5%, maybe it's 5%, to tip a market, and it's a lot more doable than people think from the outset.
Yeah, absolutely. I mean, this is not, trying to hold up the universe. You're not Atlas. It's a problem, and there's always a solution if you have enough people working on it. So, what excites you most about where healthcare is actually heading now?
Just how it's growing. We're having our event, as we mentioned, and just back in 2022 there was about 200 people there. Probably gonna have about 1,500 people. I mentioned earlier all the employers are showing up. So now that the blueprint exists, the tools are open source, they're free. You have ordinary communities using them to take healthcare back. They read these stories, and they basically fall in love with a future that they know can come into their community, and have a longing for this and are willing to do the work. And that's really the thesis of relocalizing health. Is it's going to be rebuilt locally. We don't need to reinvent everything. Obviously, we don't need a unique PBM for every hamlet in America, but they do their thing well, they become a puzzle piece. And just like you do a barn raising, yeah, you don't have to have all the forest and all the nails in that town, but the town itself raises that barn, and things really change dramatically.
Absolutely, and I love the barn raising analogy. I absolutely love that. And this question is going to sound similar to the last one, but I think optimism is different than excitement. So, what gives you optimism right now? Because healthcare conversations online often can sometimes feel like doom scrolling, but with just deductibles.
Yeah. Yeah, I mean, the headlines can be grim, but if it bleeds, it leads, all that type of thing. But the ground truth is there's full of people winning. We have thousands in our movement, And optimism isn't a mood for me. It's just what you get from paying attention to the people actually building. You just need to know where to look. If you haven't been seeing it, you've been looking in the wrong places. Obviously, Rosetta Fest is a place we'd love to have you come look. And the Rosie Awards are recognizing the best health plans in America. And all these employers come and they're like, take it, steal it, replicate it, work with me, right? And that's how the optimism is, really just a no-brainer when you see that.
And mentioned Rosetta Fest. You mentioned the 1,500 people that you guys are projected to have. If anyone listening at home and wants to attend and wants to add to that number, when and where is Rosetta Fest this year, and how can they sign up?
Yeah, so rosettafest.org's got all the information, and it's July 29th to 31st in Nashville at the Gaylord Opryland. And all the registrants get the first copies of the book hot off the press. If you're a benefit consultant or advisor listening, you can come find out about the Health Rosetta Advisor Program. You actually get to join one of our meetings while you're there, and you kind of see what it's all about. It's very different than the sort of events you've gone to before. Everybody says that. And they're the folks who are that initial beachhead. They steward about 5 million Americans. So we need to grow it more, but that's a nice start. And even before you get to Nashville, there's free things you can do. You can score your plan with the plan grader. You can run the PBM contract through Contract X-Ray. That's a nice on-ramp. And then you're like, okay, I want to get after it. Nashville is where you're going to meet the people who will help you finish the drive.
Dave, seriously, thank you for joining us today. We sincerely appreciate the time to break this down because this conversation feels a lot bigger than just PBMs. It's really about creating accountability, helping employers become smarter with their purchasing, and then giving people the ability to finally understand what they're actually buying. I think one of the biggest takeaways from today is that transparency alone isn't the finish line anymore. The future is visibility with standards and accountability behind it. And whether it's work being done through Health Rosetta, the conversations around Nautilus, or what's happening at Rosetta Fest, it feels like the industry is finally shifting from simply exposing problems to actually building frameworks for solutions. And maybe most importantly, it proves healthcare purchasers aren't as powerless as they once were led to believe. Because once employers start aligning around expectations, the market eventually has no choice but to respond. If you're an employer or a broker listening to this, the takeaway is very simple. You don't need all the answers, but you do need visibility. So if something doesn't make sense, it's probably worth digging into. And we'll keep helping you dig. This is Full Disclosure, where Andy Rodriguez and Chris Estep chat soon.
Thank you guys.